All right.
Okay. Which of the following hormones is most likely to be elevated in this patient? Estrogen, progesterone, FSH, LH, and anti-Müllerian hormone. So this is a 55-year-old postmenopausal woman. She presents with complaints of vaginal bleeding and abdominal pain. On physical exam, her abdomen is tender to palpation and a pelvic mass is noted. Imaging studies reveal a solid ovarian mass. Surgical removal and histopathological examination of the mass show lipid-rich spindle cells. Okay, the fun part is not remembering that histology. Um, Lipid-rich spindle cells, it really doesn't match with like your any sort of like your surface epithelial cell tumors. Um, let's see. So then you have your germ cell tumors and you have your um sex cord stroma tumors. It really doesn't match with any of those. And considering we're talking about hormones, it's probably a sex cord stroma tumor. Um, for some reason I want to be suspicious of a Sertoli cell tumor. Well, no. Okay, she's got vaginal bleeding. That would
Okay.
be highly related to estrogen. I'm gonna go with estrogen.
Great, great. Okay. So this is kind of your granulosa cell tumor, right? In particular. And one of the things that you can kind of get hinted off is that you're having vaginal bleeding, right? And so if you're secreting a bunch of estrogen, right, you're building up that endometrial layer, right? And kind of building off this, right? What can granulosa cell tumors also be a risk factor for? What kind of other cancer?
Well, if you have increased estrogen, wouldn't that like increase your risk of like an endometrial carcinoma or
Bingo.
breast
Yeah.
cancer?
Yeah, exactly. So those two is going to increase the risk. And so sometimes they do ask you that. So good.